All right. Good afternoon. I'm Corey Carlton with Medicare University Live. Thank you all very much for attending this first MU Live session, one of 5 this week. So they're each going to be up to about 90 minutes. Some will be a little bit less. But due to the large attendance we're having, we're not going to be able to get to all the questions. So if we don't get to your question, we will answer it via email. So the best way to type in any questions throughout the call today, just type them into the chat function or the Q&A function, and we'll be sure to address those as we can throughout the call. Now, you all should have received a workbook by now. I do know some people have been registering all the way up for the last few minutes. So if you haven't received your workbook for day 1 yet, make sure you shoot an email real quick over to support@medicareuniversitylive.com. That's support@medicareuniversitylive.com, and we'll have a workbook emailed to you. Now, the workbook, just so you know how this works a little bit, is fillable. It's a fillable PDF. So if you printed it off, great. If not, that's okay. You should be able to type everything in. But you'll notice through the presentation that there's numbers in the top right-hand side of the slide. That indicates which page you should be on in your workbook, so that way you're tracking with us. So we're going to get things going today and make sure everything is up and functioning properly. So let me hit the buttons right, and we'll be off like a herd of turtles. All right, so the way it works real quick is, as you can tell, there are daily videos and webinars. So the PowerPoint that you're seeing, that is very, very accurately reflected in your workbook. So if you're wondering, hey, I don't want to miss anything that you show on the PowerPoint, don't worry. Majority of it, the most important things, are going to be in the workbook. So also the supporting documents that we're going to reference each and not today actually, but I think days 3, 4, and 5 are going to be able to be provided to you by whomever invited you to this call. So they've got all those, and they'll be able to get them to you. So we're really, really excited to share all this information with you all. And I'd like to introduce to you the guru himself that's going to be leading you through this week. Don Meyer has been in the senior market for a lot of years. Many of you all have already seen him on some trainings, but he's not going to take a moment to brag on himself, so I can do that. There's no one better in the senior market than Don. His years of experience in sales, in training advisors, and even as a producer, these are all things that he himself does each and every time he meets with a client, and has trained thousands of agents across the country that has catapulted, launched, and taken careers in a new direction and new heights. So with that, I'm going to hand it back over to Don.
Okay, thanks, Corey. Well, welcome. I am excited to talk with you guys about Medicare. That might sound a little weird, but the opportunity in this market is amazing. I was just having a conversation last week with an agent, and the discussion drifted over to a lot of the new legislation that's being talked about right now, which is Medicare for everybody age 50 plus. And when I think about what would happen to our market, what would happen to our business if that truly became the case, that you don't have to wait till 65 anymore, that you can now get it at age 50. I mean, I believe that something like that's going to happen. And those of us who are already in this market and know how this works are going to have a big leg up on everybody else who's just trying to get in. So you want to know your information. You want to establish yourself as a credible source. You want people to think about you when they think about this market, so that when that tidal wave does hit, you are prepared for it. So we've got 5 days of training to cover with you. Now, today is going to start off at basic stuff. So please don't just, after the first 10 minutes, go, I know all this stuff, and just tune out or stop listening, because there is information. There's a lot of stories that I'm going to share with you today to kind of give you more depth and insight. You maybe flip through the workbook and said, okay, I think I know all this stuff, but there's a lot of extra information that's not in the workbook that I'm going to be going over with you. And every day is going to build on the previous day. So look at this as an investment into your Medicare career. Now, I know that all of us are taking AHIP and all the certifications right now for each of the carriers. And that is something that we do every year because we have to. But what I've learned in my 22 years of being in this business is that none of that information has helped me make a sale. It has told me what not to do, and it's told me a lot of the rules, but it hasn't helped me make any sales. The information we're going to be covering with you today is going to build your knowledge base, but there's a lot more that goes to that. Being successful in this business doesn't mean that you can pass AHIP and pass all the carrier certifications. You need to know how to apply this information. So that's going to be woven all the way through the next 5 days. So let's talk about how Medicare University Live works. All right, like Corey said, daily videos and webinars, as well as the supporting documents that you should have gotten from your upline. So let's talk about the importance of what we do. Now, it's always good to remind ourselves of this, but many people that we have talked to on about Medicare, they have never chosen a health plan before. They've worked for a large corporation. That corporation has chosen which insurance company they're going to have. Now, they may have 2 or 3 plans to pick from, but that's the extent of it. So this is a brand new thing for a lot of people. They've never chosen a plan, and they're intimidated by it. And we don't always appreciate that, and we have to remember that. Also, you need to remember that this is the type of insurance that seniors have that they use more than anything else. This is the most important product to them because they know that as they age, their health is going to go down. And for many of them, it is the number one concern for them, even more than their retirement. And honestly, it does have a direct impact on their retirement. If they don't pick the right plan for their situation, both financially and health-wise, it can have a huge impact on their retirement. So most people cannot afford to get it wrong, and that's where you come in. So to give you an overview of what we're going to cover today, these are the things that are on our agenda for today. Medicare basics, all right? Parts A, B, C, and D, how to sign up for Medicare. We're going to talk about Medicare supplements. We're going to talk about Plan F and what's happening with Plan F and C. We're going to talk about how to quote Medicare plans. We're going to talk about Medicare supplement replacement, which is really important. And then we're going to talk about United Healthcare's Medicare supplement, as well as my personal Plan F philosophy. So let's start off with Medicare basics, all right? Medicare was formed back in the 1960s, and it was designed for, at that time, for what's known as the disabled and the elderly. Now, you might have people ask you, what does CMS stand for? It's a little different. It's actually CMMS, but it's referred to as CMS, which is the Centers for Medicare and Medicaid Services. So original Medicare has 2 parts, all right? Part A and Part B. Those are called original Medicare because for many, many, many years, that's all there was to Medicare. So it was dubbed original Medicare. So let's start with Part A. All right, Part A is known as hospital insurance. I'm sure many of you know this already. In order to qualify for Part A, they have to be at least 65 years old, and they have to have worked at least 40 quarters where what they did was contribute into the Social Security system. And it can be that a spouse is covered under his or her spouse. So if a husband has worked for and contributed for 40 quarters, but the wife didn't, she would still have access to Part A with no premium. Now, there's certain classes of people out there, like pastors, for example, that can opt out of paying into Social Security. And if they have a particular plan, a retirement plan from their denomination or something like that, that's great. They can use that. But it may make sense for them to at least contribute for 10 years. The other way to get qualified for Part A is if you have been on Social Security disability for 24 months. Now, I know it sounds a little bit weird, but yes, that's exactly the way it works. If I I'm on Social Security disability. That means I have a serious health problem. And the government basically says, you know what? We're going to give you this money, SSI, Social Security disability income, and we'll do it for the starting now. But you're not going to get any insurance now. You have to wait 2 years, and then you would qualify for Medicare. So that's just the way it works. On month 25, they will be automatically enrolled into Part A. Now, there is a deductible, and this deductible changes from year to year. The current deductible for Part A is $1,364, and that is per benefit period. Now, I had somebody ask me last week, a potential client that I was sitting with said, well, if somebody comes out of the hospital and then they go back in for that same condition, they shouldn't have another deductible, right? And I said, no, that's actually not the way it works. The way it works is that if you're in the hospital and once you get out, the clock starts ticking. And if you're out for 60 days and you go back in, it doesn't matter what the condition is, you have a new deductible that starts over again. Now, I would never let anybody have just Part A be the only coverage they have for their hospital, because they could have multiple visits a year that would result in multiple deductibles. But that is the deductible currently, $1,364. And again, it's per benefit period. Now, premium. There is no premium for Part A for most people, as long as either the husband or wife has worked and contributed for 40 quarters or 10 years into the system. All right. And if they have not, then there would be a premium for Part A. Now, I see this most often with some of my clients who have moved here from another country. And I have quite a large population of Indian clients personally. And they've all been very successful as doctors and professors, for example. And then their aging parents move over here to live with them. And their parents move here mainly because they want to be next to the kids, but also because of the access to our healthcare system. And they don't have Part A. So they either go without for hospital for Part A, or they're going to have to pay the premium. And it's over $400 a month, but people can buy it if they have not met the qualifications for it. All right, so now let's talk about Part B. In order to qualify for Part B, you have to be at least 65 years old, or also the same thing, you have to be on Social Security disability for a full 2 years. Now, the deductible for Part B is $185, and that is per year. It's not per benefit period, it's per year. Now, the premium, the standard premium, is $135.50 per month, and that's taken directly from their Social Security check. If they're on Social Security, they don't have the option. All right, that's where it's going to come from. Now, one of the things we're going to talk about a little bit more in depth in a future session is something called IRMA. And IRMA stands for the Income Related Monthly Adjustment Amount. This is basically a surcharge that Medicare places on people who and I put it in quotes, make too much money. All right? So we'll talk more about that later, but that means that their Part B premium could be higher. The other thing you need to know about Part B is the penalty. And we're going to talk about how the penalty works. But the penalty is 10% per year for every year that you didn't have the correct creditable coverage. So let's talk about this penalty for Part B. And we're going to talk about the penalty for signing up too late. So if you don't take Part B when you turn 65 or you retire, you must have other creditable coverage, or you will face a 10% penalty per year for the rest of your life. So what that means is 3 years late, you're going to have a 30% more premium added on for the rest of your life. And it's going to be added on not to the original premium of when you first started. That percentage is going to be a percentage of whatever the current Part B premium is. So you might have somebody, and I've had this happen to me, especially some people I've had that are having to pay IRMA. Like their IRMA could be over $400 a month. And so they say, well, you know what? If I'm paying $400 a month for Part B, and I'm really healthy, Don, I just don't think I'm going to take it right now. It's too expensive. I'll just roll the dice, take my chances for the next couple of years, and then I'll join. Well, there's going to be a problem with that because they're going to have a penalty, and it really does add up. So they should not do that. The other thing that your clients need to know is that COBRA is not considered creditable coverage for Part B. So I'll give you an example of a client. He came to me when he was age 65 and said, "Hey, Don, I've retired at 64. And my wife is 7 years older than me. And when I retired at 64, we were both on my company's insurance, his company's insurance. And so we just both decided to stay on his COBRA plan for the next year. So he turned 65, gets signed up for Medicare, and she goes to sign up for Medicare, and guess what? She couldn't get it. All right. And she was confused. And so they consulted me and said, why can't I get Medicare? I mean, we've had creditable coverage the whole time. Yes, you have, but COBRA is not considered creditable coverage for Part B. So what had to happen is she had to wait to enroll. She had to wait during to the general election period. So the general election period is that election period for all those naughty people who didn't do what they were supposed to do on time. Now they thought they were doing right, but that's why people needed a knowledgeable advisor like you to be able to help guide them through this. And so if you are going to enroll into Medicare during the general election period, you have from January 1 to March 31 to turn your enrollment form in. But your Part B will not be effective until July 1. So that's how it works if you sign up too late for Part B. Now, on the other side of the spectrum, you can also have people that enroll what we call too early into Part B. And what generally happens is this is when they are auto-enrolled, all right, with Social Security. In other words, they're still working and they're covered under their group insurance. And so it's common nowadays for people to say, I'm not going to wait for Social Security till I'm my full retirement age at 66 or whatever, 66 and X number of months. I don't think Social Security is going to be around, so I'm going to take it as soon as possible. And so last week I met with a couple, and the wife started Social Security at 62 because he goes, I did the math and the break-even point and her health, and I'm like, okay, that's fine. So, that's good. But if somebody does take Social Security early and they still have group coverage at work, then the problem is they're paying for coverage that is unnecessary. There's no reason to pay Medicare for your medical insurance and a group insurance plan for your insurance. That's just double paying, and you don't get anything for it. But the bigger problem is that they lose their guaranteed issue enrollment for their Medicare supplements. See, the Medicare supplement open enrollment period, or that's what it's known as, for open enrollment for Medicare supplements, not to be confused with open enrollment for Medicare Advantage, which is January, February, and March. We'll get there later. Is that's all driven off of the Part B effective date. So if their Part B effective date is back when they turn 65 and they say, well, I'm losing creditable coverage from my employer, doesn't matter. They're going to have health qualify to get a Medicare supplement. I've had that happen to my clients in the past where they didn't realize that they were auto-enrolled in their Social Security into Part B when they got started their Social Security early, and that is a problem. All right, so we don't want that to happen. The other challenge that some people have is they decide, well, what if I just don't get anything besides Part B? I mean, original Medicare, I get A, I have B, maybe I'll get a standalone drug plan. There's nothing wrong with that. There's no penalties for that. But the challenge is that they are responsible for 20% of all of their medical charges. Part B will pay 80, but whoever the supplement is, or if they don't get one, that individual person is responsible for 20%. And the problem also is that there's no limit to the amount that could be charged to them. And interestingly enough, the number one reason for bankruptcies in the United States is due to medical bills. Medical bills are really expensive nowadays. And so people don't want to have to pay that. So it's always advisable, all right, for them to either have a Medicare supplement or a Medicare Advantage to go along with their Part A and B. All right, let's talk about the next two parts of Medicare. This is Part C and D. So these two parts here have a couple of things in common. Number one, they were both created by CMS. In addition, you must get these from a private insurance company. You can't, even though the government created them, they're not selling them. So you have to get it from a private insurance company because they're not offering it. And all the benefits can vary from one company to the next. So that's how those work. So let's talk a little bit more about Medicare Advantage now. All right. Medicare Advantage covers only the health benefits. That's what MA stands for, Medicare Advantage. Now, the term MA and MAPD are often synonymously and used synonymously, and I do that sometimes too. But the Medicare Advantage MAPD is different than an MA because the MAPD includes prescription drugs. Now, there's no deductible generally. Generally, there's no deductible. Now, if they go out of network for services, then there's often another deductible and another maximum out of pocket. All right. So they must stay in network in order to not have a deductible. Now, there might be a deductible on the drug side, but I'm just talking about the health benefit side right now. And that's why you need to check the summary of benefits for that carrier. Now, premiums. Some have zero premiums, others do not. So there's no line on your workbook there for not. Put that in there. Some do not. It just depends upon where you live. Again, check the summary of benefits. Now, in order to be eligible for a Medicare Advantage plan, you must have Parts A and B. Some people think that if they join a Medicare Advantage plan, then they lose Part A and B. That's actually not true. You must maintain Part A and B. You must continue to pay your premiums of at least $135.50 every month for Part B in order to get a Medicare Advantage plan. It's that the difference is that if you're on original Medicare, Medicare itself is paying those claims. If you join a Medicare Advantage plan, the private insurance company is paying those claims. So you must have A and B, all right? Now, the other thing to note about Medicare Advantage plans is their benefits and their premiums and everything that goes with them is all delineated by the county that the person lives in. All right? And in order to get one of these plans, you must have an election period. We're going to talk a lot about election periods. Now, high-level stuff here, just high level, we'll dive more deeply into each of these plans in a little bit, is the prescription drug plan. All right? Now, it's similar to the Part C, but the way this works is that you must have Part A or Part B. They don't have to have both, but they have to be eligible for Part A or enrolled into Part B. These plan details, premiums, etc., are based on the region that you live in. And I'll go over the regions with you in a future training session. And of course, you also have to have a valid election period in order to enroll into a prescription drug plan. Now, with prescription drug plans, there's a premium. It's always a premium unless it is tied to a Medicare Advantage plan that does not have a premium. So if you're on if there's a zero premium MAPD plan, it means there's no premium for the health part or the drug part. And LIS, which is low income subsidy, we'll talk about that as well, who qualifies and how to tell if somebody qualifies in a future training session. That means that there's still a premium, but it's just paid for by the government. All right. Now let's talk about the penalty for Part D. Works similar but different to Part B. If somebody does not have creditable coverage after they're Medicare eligible, then they're going to face a 1% per month penalty for every month that they don't have coverage. So a couple of years ago, I was visiting with a client. He had sold his house, he and his wife, and they were moving to Florida, and they were staying with a friend at her house in here locally. And so she sat in the other room as I helped him enroll into Medicare, and I mentioned this penalty. When I finished, she said, "Can you help me?" And I said, "Sure." She said, "Well, I'm 70 years old, and I've never gotten a prescription drug plan because I didn't really understand them. She's from England, and has lived here, but she's a citizen. And I said, well, I can help you, Chris, but you're going to pay a 60% penalty. Now, the good thing is we don't have to calculate the percentages and the amount that they owe. And also, that penalty does not get paid to the insurance company. That is collected by Medicare. All right, they're the ones that are going to tell me exactly what that is. And that 1% penalty is based on the national average Part D premium. And that changes from year to year also. And we're going to talk about that when we dive into Part D in more depth. The other important thing to know in the beginning here with prescription drug plans are the deductibles. So it's the standard plan designed by Medicare allows two deductibles, an initial deductible and a deductible in the middle that's technically called the coverage gap, but it's also known as the donut hole. All right. Now, the best way to describe and teach people about what the coverage gap is and if they're going to hit it, because they really don't care about what the numbers are. What they really care about is if they're going to hit it. And I'm going to show you this week how to go to Medicare.gov and show them the color graph to be able to let them know when they're going to hit it, if they're going to hit it, what month it is, what their copays are going to be, when they're going to get out of it, when they're going to get into catastrophic coverage. So there's a really great way to explain that to people using Medicare.gov. Now, another common question that your Medicare beneficiaries are going to ask you is, how do I sign up for Medicare? When do I sign up for Medicare? And the answer to that is, it depends. All right, you need to know what their situation is in order to guide them. So the first question that I always ask people when they say, how do I sign up for Medicare? My first question is, are you taking Social Security yet? Because if yes, they don't have to do anything. All right, they will automatically be enrolled into Part A and Part B. And the premium for their Part B will automatically be taken out of their Social Security check. Since the government has a way to pay that premium for Part B, they're going to automatically enroll everybody who is already taking Social Security by the age of 65. And again, one more time, you need to watch out for people who are still working but taking Social Security. They may have double coverage, and that could cause problems. Now, here's one thing people ask me. Well, if I drop my Part B, Don, how will I ever get it back again? And that's not a problem. I've had clients that have. Did the camera just go off? Okay, there we go. I'm back. I've had clients that back in 2008, 2009 had retired, thought they had plenty of money to live for the rest of their life, and were on Medicare. And then, of course, they didn't have their money invested or in the right products, and they lost 30 to 40 or more % of their entire life savings. And so many of those people ended up having to go back to work again. In fact, a lot of them went to work at Walmart. And Walmart's got a pretty good health insurance plan, you would imagine, so they're a pretty big company. So what they would do is they would go to they would counsel. I would counsel with them. I'd say, you can drop your Part B and get on Walmart's health insurance plan, and they did, and they worked there for several more years, and then they decided to leave, and they got Part B back again. So they can do that. All right. Some people think that if they ever drop it, they can't get it back, and that's not true. All right. They can decline Part B if they don't want it, but they have to take action. If they do not want Part B, if they are currently working and going to stay on the company health insurance plan, and oftentimes that makes sense if they have a younger spouse that they need to have coverage for. For most people, depending upon what percentage or amount that their company contributes for them for their health plan, for most people, going on to Medicare is a better deal for them. But I understand that sometimes they have a spouse that's younger and they need to stay on the company health insurance plan to cover the rest of their family. And so if they do not want Part B, they need to cancel it. I strongly recommend that they make a photocopy of their Medicare card, and then they send that card back to Medicare, not Social Security, but to Medicare, with a note that's saying, please disenroll me from Part B. So that's important for them to do. If they're auto-enrolled into Medicare Part B, they should get their card at least 2 or 3 months before it takes effect. So they have plenty of time to cancel it. So that's an important thing to know. Now, for those not on Social Security prior to 65, all right, and maybe they want to delay their enrollment into Social Security because they know that they're going to get that increase. Anything after their full retirement age, which of course the full retirement age is continuing to go up, there's an 8% compounded annual increase in Social Security for every year you wait. Now the maximum age they can wait to is 70. All right, after 70, you can't keep delaying and letting it grow. They just have to start paying you at age 70. All right, but if they do want Part B, then they have to take action. All right. Now the online enrollment is the best way to enroll into Part B, but it only works when you're signing up for Part A and B at the same time. If your Part A and your Part B dates are going to be together, you can use ssa.gov to enroll, and it's very easy to do. They'll create a username and a login, and they're going to need to remember that, and they can do the process online in a matter of minutes. All right. Now, many employers do want you to enroll in Part A. You may or may not know this, but if there's 20 or more employees in the company, then the company insurance is primary and Part A is secondary. But if there are less than 20 employees in the company, then Part A is primary. So a lot of the smaller companies absolutely want everybody enrolled into Part A when they turn 65, because that's going to be fewer claims for the company's health insurance plan. Now, the main reason to delay enrolling in Part A is if you are still working and you would like to contribute to an HSA, right? Or if you'd have to pay a premium for your Part A. So if somebody moved over here recently, or somebody just hasn't gotten their 40 quarters in, they may want to delay Part A. All right, they can do that. I've had clients do that, delay Part A. It's very unusual, but you can do it. But if they want to contribute to an HSA, they cannot be enrolled in Part A. All right, that's an important thing to remember. Now, if you don't enroll in Part A when you turn 65, whenever you do enroll into Part B, your Part A coverage will go back retroactively. So that's an important thing to know. So for those that are going to be retiring and they need to get onto Medicare, like let's suppose that I am now 67 and I've been on company insurance the whole time. I'm ready to retire now and I want to get onto Medicare Part B. They need to fill out Form 40B and L564E in order to sign up for Part B. All right, those are the two form numbers that they have to have. And you should have these forms saved to your computer so you can email them or you can print them and give them to your clients. The more reliance that you can create on you for getting things done with your clients, the better it is. Now, if you're an agency owner, you want all your agents to be self-sufficient. You don't want them calling you every time they have a question. But you do want your clients to call you because the more reliant they are on you, then the less likely they're going to cancel their plan ever in the future or even think about going with another agent. All right? So you should have these forms and be familiar with them. Now, the Medicare beneficiary, they are going to fill out Form 40B. Here's an important thing to instruct your Medicare beneficiaries when they're filling this out. In the remarks section of Form 40B, they should list the date they want their Part B to take effect. Form 40B has got, I think, 4 pages to it, but 3 of them are instruction pages. There's only one actual page that needs to be filled out, and that one page is the only one that needs to be turned in. But if I decided that I was going to retire, say for example in September, and I turn my form in now, they may make my Part B effective in August. And I don't really want it to be effective in August because I've got company insurance. So if you don't put the date, if they don't put the date that they want their Part B to be effective, Social Security is just going to put it the next month. And so that's what you use the remark section for, because there is no spot on there where you request the date that you want your Part B to take effect. And then the employer fills out L564E. That's what they do. And it basically just states that they have had credible coverage this whole time since age 65 until now. That way there's no penalty. So it ensures that there's no penalty for their Part B late enrollment. And when these two forms, 40B and L564E, are complete, they need to be mailed to the local Social Security office. Now, of course, they could go down to the Social Security office, turn them in by hand if they wanted to. Not advisable, in my opinion. That's never a very fun experience. But they need to be mailed together, the two pieces of paper, to the local Social Security office. And people often ask, well, when can I do this? Well, they can enroll 3 months before they turn 65, or 3 months before they want their Part B to begin. Okay? So that's 3 months beforehand is the earliest that they can enroll. So let's talk next about Medicare supplements. All right, there's a lot of information flying around right now amongst seniors regarding Medicare supplements. So this chart you see here in front of you are the current plans that are available for Medicare supplements. As you can see, there's Plan A, Plan B, Plan C, Plan D, not to be confused with Part A, Part B, Part C, and Part D. Of course, yes, it is confusing to a lot of people, but there is a difference. So these are the plans. And then there's, of course, Plan F, and you're going to see a little asterisk by F. That means that it talks about the details of high deductible Plan F. There's Plan G, K, L, M, and N. All right. So with these plans, those are the plans that people can choose from. And why do they have the plans outlined that way? Well, because all the plans for Medicare supplements have to be standardized. So let me kind of give you an example of why they're standardized. Soon after Medicare came out with Part A and Part B, and private insurance companies recognized an opportunity to develop a product to fill in the gaps that were left by Part A and Part B, the deductibles and the coinsurance. That's why you'll often hear Medigap and Medicare supplement used interchangeably because they mean the exact same thing. So when these original Medicare came out, Part A and Part B, insurance companies said, hey, here's an opportunity. Let's sell a plan that will fill in these gaps. So as an example, company comes up, I've got the Super Medicare supplement plan, and they're out selling it. And then another company comes in and goes, yeah, I've got the Super Duper Medicare supplement. It's going to cover these things and those things. And then another company comes in, oh yeah, I've got the Extra Super Duper Medicare supplement, and it covers these other things, and these are more important. And the other guy goes, no, these are more important. And Medicare beneficiaries, quite honestly, were just getting confused. So basically the government stepped in and said, okay, time out. Listen, if you're a company that wants to sell Medigap or Medicare supplement plans, here's the way it works. These are the plans, and if you're going to offer this plan, it has to have these benefits, and this plan has to have these benefits, and every plan has a different set of benefits, as you can see from the chart, whether it's covering 100% or 80% or 50% or whatever it is on that chart. This is the way they have to fall in line. So all the plans are standardized, meaning every plan C from every company must cover the exact same things. So Medicare beneficiaries can compare them. Then what the government did is this. They came in and they said, you know what? We need to levelize the commissions. You might be going, well, what do you mean? So in the old days, these original Medicare supplement plans, agents were paid very similar to any other kind of health insurance plan, where there's a higher first year commission, and then in month 13 or year 2, it drops to a renewal level. So if I'm an agent and I go out and sell you a Medicare supplement, maybe I sold you Plan C, and I'm looking at that nice renewal, commission check coming in, and then in month 13 I see my statement, and I'm like, whoa, it went way down to this renewal level. I don't like that. Oh, I know what I'm going to do. I'm going to go back out, knock on the door, talk to my Medicare beneficiary, and say, hey, listen, you got Plan C, and that's good, but Plan D is even better, and let me move you to Plan D. And so they'd move them to Plan D. And then guess what would happen 13 months later? They'd back out there again. Let me move you to Plan F. F is better than D because it's higher in the alphabet or whatever, right? And so people were churning or twisting or whatever you want to call it, business. And that was not helping Medicare beneficiaries. So the government said, we're going to stop that. So now the way it works is that all your commissions for Medicare supplement plans are levelized, meaning that for the first 6 or 7 years, whatever you get in year 1, you get in year 2, 3, 4, 5, 6. Some states it's 7, Texas. And then, of course, after that, they can do what they want. They can stop paying you commissions completely, but most of them will either continue it or they're going to offer something called service fees, which means they're going to pay you a different percentage. So the commissions are levelized, and that was because of things agents were doing. Then what happened is that the government, back in June of 2010, decided that they were going to modernize the plan. And you can see by looking at this alphabet that there's certain letters that are missing, like E. Okay, E is gone, H is gone, I is gone. All right, those all got taken away. J was taken away back when Part D came out, but the rest of them were taken away in 2010 when the government said, these plans need to be updated and they need to be modernized. So some plans went away, like those letters I just mentioned, and other plans had to be updated. So Plan D got updated. The home health care benefit got taken away, and all the hospice stuff got moved around. So now the plans are modernized. Now, speaking of modernized plans, okay, we all know that there's something new happening, all right? Plan F. Now, due to MACRA, maybe you've heard of MACRA. That's the Medicare Access and Chip Reauthorization Act, which is a weird name, but it's called MACRA, is changing what's happening with Medicare supplement plans. And it's important for you to understand this because I want to tell you this right now. We're going to talk more about this when we talk about marketing for Medicare. It has never, ever been more easy to get in front of a Medicare beneficiary than right now. Medicare beneficiaries are getting bombarded, just like when they turned 65 and they got that stack of mail from 4 dozen companies. They're getting inundated right now. Plan F is going away. And some people think that, oh my goodness, Plan F is going away. That's what I have. Am I going to lose my coverage? And there's a lot of myths out there. There's a lot of misinformation out there. There's a lot of fear being circulated amongst people. All right. There's a lot of agents that are telling people that Plan F is going away and they need to buy Plan G from them. Right. And so you need to understand what's truly happening with Plan F. It is the most popular med sup being offered today. That is the most popular plan. But effective January 1st, 2020, Plan F and C will not be available to anyone new to Medicare. So if you become new to Medicare on January 1st, 2020 or later, you are not going to be able to have access to Plan F and C. However, if someone turns 65 before then, they can still get it. If they're on Social Security disability before then, they can still get Plan F. All right, so they can still get it. But after that, they will have to health qualify. So in other words, Medicare supplement companies are going to continue to offer Plan F and Plan C, people will have to health qualify. So what's really popular about Plan F, of course, is that it picks up all the expenses that original Medicare does not pay. Anything that is considered a Medicare approved expense, in other words, your doctor says that it is medically necessary for you to have this procedure or treatment or whatever it is, then if Medicare covers it, Plan F will pick up the rest. Now, there's a couple caveats to that, but if Medicare is going to cover it, Plan F is going to pick up the rest. All right. So that means that there's going to be zero copay, zero coinsurance, and zero deductible. Right. And that's why they're going away. The government wants people to have skin in the game. All right. So let's talk about the biggest difference between Plan G and Plan F. In Plan G, the beneficiary has to pay the Part B deductible. So Plan G is a very good plan, all right? And that's really not a bad idea for people to get it, provided the Part B deductible stays at a reasonable amount. That's the key, all right? Now, it does cover the Part B excess. So that little line that's in your workbook, just ignore that. It does cover the Part B excess. And in fact, let me talk about that real quick here. Some people ask me, they're like, Don, what is the Part B excess and how does that work? All right. Because when we get to Plan N here in a minute, you're going to find that Plan N does not cover the Part B excess. We're not going through all the plans. We're only going through F, G, and N. That's it. That's all we're going to do. Let me talk to you about what the Part B excess is, because your clients, when you sell them a Medicare supplement plan, you're required by law to leave them the outline of coverage. And we're going to look at an outline of coverage here in just a moment. And they're going to see that Part B excess is on there. And they're going to ask you, what is that? So basically, the Part B excess is this. If I'm a doctor that's a Medicare approved doctor, all right, that does not mean that I've passed some test or I have got some great credentials that Medicare is going to allow me to be a Medicare approved doctor. A Medicare approved doctor simply means that I agree to accept Medicare's fee schedule. Medicare has a fee schedule, a billing code for every single thing that can be done to a person. A Band-Aid, an aspirin, an IV, a knee replacement, a heart transplant. I mean, everything's got a code. The codes are bigger than the IRS codes, right? And so if I'm a Medicare approved doctor, all that means is that I'm accepting Medicare's fee schedule. Well, I might say to myself, you know what, they're just not paying me enough, and I'm going to charge more. Well, here's the way that works. If I decide to charge more for my Part B, my doctor of medical services, and I want to remain a Medicare approved doctor, then I have to only charge an extra 15%. Can't charge any more than that. If I start charging my clients 20 and 30 and 40% more, I'm going to lose my contract with Medicare. Now, there's some doctors that are choosing not to take Medicare. But I want to let you know something. That is a very, very, very small minority of doctors. Because most doctors realize this, that people use their health care more as they age. So if I'm a doctor that decides not to take Medicare, I'm losing out on the majority of the population who accesses health care. Now, of course, some doctors like pediatricians really don't need to take Medicare, but any other doctor pretty much needs to take it. So there's still plenty of doctors that do take Medicare. But the Part B excess just basically says, if that doctor does want to charge extra, it is capped at 15%. And Plan F and Plan G both pick up that extra 15%. Most doctors don't do this right now, but it could happen in the future. All right. So let's talk now about Plan N. All right. Think of Plan F, and then there are a few things beneficiaries must pay. With Plan N, they have to pay the Part B deductible. Secondly, they have to pay the Part B excess if the doctor does charge it, again, which is very uncommon. but the premiums are significantly lower. Very good option for people. Now, there is a $20 copay that people have to pay every time after that deductible is hit. So if I choose Plan N, first time I go to the doctor, I need to know that I'm going to have $185 of that deductible that I'm going to have to pay before the insurance kicks in. Once the insurance kicks in, then I pay $20 doctor copay for most services. If it's like an annual physical that's covered under basic Medicare for free, then no, I don't have to pay $20 for that visit if it's coded correctly, right? But that's the $20, and it doesn't matter if it's a primary care physician or whether it's a specialist. It's a $20 office copay. There's also a $50 ER copay, and that does not get assessed if they get admitted. All right, but that's $50 for the emergency room. So Plan N is a really good option for people on Medicare that are not yet 65, all right, which means they're on disability. Most of my Medicare clients who are not yet 65 that want, or a Medicare supplement is the right plan for them based on their health conditions, they almost always get Plan N. And what I do is I say, okay, Plan F is going to cost you $765 a month. I just looked this one up this morning for somebody down in Alabama. Plan N is going to be $477. So after you get your Part B deductible paid, how many office visits would you have to go to per month for that to make sense for you to have F instead of N? And so you just have to do the math, right? That's how that part works. Now, the best way to figure out the right Medicare supplement for somebody is to use the quoting software, all right? So there we go. So we're going to look at the quoting software. Can everybody see that?
No, not yet.
Not yet. Got to have technical support do this for us.
All right.
Okay, so most of you have access to seniormarketsu.net. Looks like mine's coming up on this is seniormarketsu.com, but I think it's seniormarketsu.net, and you can click on the Medicare quoting software. All right. So when you get onto this site, there's a few things, and this comes because of iGroup Senior Markets has given you permission to do this. So it may ask you for a username and password the first time you're in. You need to get that from the person who invited you to this training. But this is a great software because you can look at Medicare supplements, Medicare Advantage or PDPs, and run quotes for final expense insurance as well. So we're going to talk today about Medicare supplements. So you click the quote. I'll just put in a zip code here. All right. Age, I can pick whatever age of the person is that I want. We'll just say 65-year-old female. And then there's this household discount. And the household discount is applied or is not applied. So we're going to say that it is applied. And then I'm going to scroll down once I can figure out how to get over this bar. There we go. And click Get Quote. I can't see me in the video.
You know, I turned it off since you're working on the computer.
Ah, got it. Okay. So here we go. So this is how you will quote somebody. You can see here that it's going to list them according to the lowest premium, and then it's going to go down. Now, one thing I want you to note is that look at in my area, 117.26, 117.42, 117.65. I mean, the top four companies are like within $1 of each other. So you've got to find the company that you like. Now, if you want to know more details about the company, one thing that you can do is you can't really see it over here on the left-hand side, right? But if you click anywhere over here and just start going down, there's more things that you can look at, such as market analytics, right? The market analytics are going to show you different rate increase history with companies, right? So what is their age 66, 67, 68, and 69? What is how many people do they have covered in your state? What is their loss ratio? So it has all this extra information. The rate increase history. So that's important because clients are going to ask you about that. So you will have this market analytics on each of these different companies. So that's how you turn that on. Click it again. That's how you turn it off. So that's what you do. It tells you if there's a household discount. Now you just need to know that for household discounts, every company has it a little bit different. Some companies require that the other person actually be a policyholder of the company as well in order for this person you're enrolling to get the discount. Some companies say, well, as long as they're over 60 years old, then they can get the discount. Some companies say it's over 18 years old. So you have to know how it works with each company. That's why you will always have more than one Medicare supplement company that you'll be contracted with, because they all have a little bit different rules, and it's important for you to understand those. So it tells you how many years the company's been in the market. So this is just the important things to note about using the software. And of course, you just remember too that there's a policy fee for almost all these companies. Not all of them, but most of them, it's a $25 one-time policy fee that they're going to have to pay when they enroll into this plan. All right? So this is an excellent tool to use. So you need to go up and quote a different person, and you can come up here and say, okay, the wife is 65. Now let's go to the male. Maybe he's 68, and maybe, he wants to see Plan F, and we're going to get quote. You just click that there, and it's going to change and give you the prices for the next person. So that's the software that you have access to, because the person who has contracted you or invited you to this has got access to it. So that means you have access to it. Get it back. See if they can see it or not. All right, we're going to go back to
Well, it keeps me around.
That's right. Kind of the brains of the operation here. Okay, so let's look at an outline of coverage for a Medicare supplement plan. I just chose Plan F. Plan F is my favorite plan. That's what I sell to everybody, unless they're buying Plan N. And that's going to end, of course, here, and the rules are going to change. But Plan F is just great because it's simple. It covers everything. So you're going to notice that when you look at an outline of coverage, they pretty much all are set up where it says what the services are in the left column, then what Medicare pays, then what the plan pays, and then the one that people really care about is what's in that right-hand column, and that is what you pay. And what I like to show everybody is that it's, 0, 0, 0, 0, and then where it says all costs, that's if you've been in the hospital for more than 365 days. Not very common these days for that to happen. Now, it's important that you use this outline of coverage to be able to help people understand that this Medicare supplement plan is not going to pay for their nursing home, because you can see here that a skilled nursing facility, the first 20 days, okay, Medicare is going to pay all of it, provided they've been in the hospital for 3 days, they're in a Medicare-approved facility within 30 days of leaving the hospital. And one thing that's left off of here is if they're showing signs of improvement. All right, this is not all inclusive. This is just the highlights, an outline of coverage. It's not policy detail. But as long as that's happening, the Medicare will pay all approved amounts. The plan pays nothing because there is nothing to pay. Now, days 21 through 100, Medicare is going to pay all but $170.50 a day. But if they have Plan F, guess what? It'll pay $170.50. So what does the client pay? Zero. But it's always important to point out to your clients that after day 100, who pays for all the costs? Your clients do. Which then, when you tell them this, you can ask them. So I'm just curious. I know we're not talking about it right now, but do you have an extended health care plan in place? Now, that's my new favorite term. I got into this business 22 years ago, and the company I worked for sold nothing but long-term care insurance. That was all we did, nothing else. And so every day, that's all I was selling. I was very passionate about the product, and we always called it long-term care coverage, right? Or long-term care insurance. But that has gotten a really kind of a more negative connotation as the premiums for those plans have gone up. And everybody knows someone who's got a plan, and they're so expensive, right? So I call it an extended healthcare plan. And I ask them, do you have an extended healthcare plan for who's going to pay for this after this? And most of them are going to say no. And I say, well, maybe I can help you with that some other time. So you're setting yourself up for a future sale by using this outline of coverage on a Medicare supplement. If you haven't been doing it, you need to. People need long-term care. They need extended health care plans. So anyway, just focus on the right column where it says you pay 00000, right? Everybody likes to look at the zero. Okay, the next page for medical expenses, again, 0000000. And that's exactly what I do. I just tell them 000, and they all like, oh, I like that. Okay, and then 000 and international or foreign travel. Okay, there's where it has that Medicare is going to have a $250 deductible that you're going to pay, the client would pay, and then they're going to pay. The Plan F would pay 80%, and their client would pay 20%. Now, generally, as I mentioned earlier, the supplement's not going to pay anything if Medicare doesn't pay first. Here's one exception to that, and the maximum is $50,000, which in a lot of other countries will go a long way. So that is how the outline of coverage works for when you're selling somebody a Medicare supplement plan, and you need to go through this with them, and you need to leave it with them. So let's talk about replacing Medicare supplements. This is an important thing to know how to do correctly, and I'll tell you why in a minute. So what you want to do, if you sit down with someone who has a current Medicare supplement, find out who their plan is with, find out what the premium is. Then see if you can beat that price. How do you find that out? You go to the Senior Markets website, and you click on there, and you put their zip code and their age and their tobacco use, and if there's a household discount that applies or not, and you run the quote. If so, if you can beat that price, then you can help the client, but do not tell them that yet. Do not tell them that you can beat that price yet. Why? Well, you need to ask the health questions, right, from the application to make sure they qualify. Very important. Make sure that you ask the health questions to make sure that they can health qualify. All right? And here's the reason you need to do that. I was with an agent one time. I was up in Kentucky. We sat down with somebody who had a Medicare supplement, did a little review, found out we could beat that price. And he got so excited that he blurted out, yeah, we can help you save money, and told him how much. And the client got really happy, went to fill out the application, and guess what? They had to answer yes to one of the health questions. And so that meant that, they weren't going to be able to qualify for a lower premium. Then he proceeded to see if he could review their life insurance, and the person just looked at him and said, I don't think so. You lied to me. You can leave now. So you want to make sure that you always know they can health qualify before you tell them that price. So that's the reason why. Now, once you know that they can health qualify, then what I'm going to encourage you to do is do your presentation. I'm going to talk to you about what you'll actually say here in just a moment. but it consists of repeating that all Med Sup plan benefits must be the same for each carrier, but that the prices can vary. All right. So I will show you some sample phrases in a moment, but here's what you're going for. All right. When you pause at the end of your short presentation and the client can finish your sentence, right, then you know that they are comfortable with and understand the new information and you're ready to move on to the close. You'll see what I'm talking about here just now. So here's what I start. I tell people, once I know that they can help qualify, I'll say all Medicare supplement plans are created by the government to be exactly the same. You're going to notice that there's one word that is repeated over and over in this. The benefits in one plan from one company must be the same as the benefits in the same plan with another company. So the benefits with one plan, with a plan from Bankers Life, must be the same as the benefits with the same plan from Physicians Mutual and all other companies. If you go to the doctor or hospital and have no copay with one company and you switch companies, when you go to the doctor for that same service, you will still have no copay. The government has mandated this so that seniors could compare plans from one company to the next more easily. There's only one thing that is different between each company. Do you know what that is? Yes, the premium. Sometimes they say the price. That's fine. So you should consider going with the company that has the lowest price. Now, if you have Plan F with one company and you switch to Plan F with another company, then the benefits have to be exactly and this is exactly how you do it, have to be exactly and they'll go, same. Great. They get it. See, this is a senior selling technique, and it's called repetition. Now, I'll tell you something. When you're selling to seniors, it's a little different than selling to millennials. If I have to tell my kids the same thing over and over again, they get really frustrated with me. But with seniors, it's very different. See, most seniors are afraid of making a mistake. They don't like change. And for most people, the older we get, the less we like change. Just the way it works for many of us. So they have some concerns about changing from one company to the next. This company's been really good to me. They paid my bills, all my claims. That's great. The next company is going to do exactly the same. So what you need to do is you need to get them comfortable with this information. And the way they become comfortable with something is repeated exposure. And the way that that's why advertising companies put the same ad on TV over and over and over again until you're sick of it, but you're now comfortable with this company or this product. And so you're going to do the same thing. If you get to the end of this part here and you say, all the benefits have to be exactly and they go, I don't know what you're talking about, then all you do is you go back to the beginning and you start over again, right? And you just make sure that they understand that's how it works. Then they feel comfortable after that repeated exposure, and then they'll make the change, all right? So that's an important senior selling technique. Now, the next thing we're going to talk about is why you need United Healthcare's Medicare supplement. There's some pros, there's some cons to it, and I have to tell you this before we get started, that not every state has the same underwriting requirements. In some states with United Healthcare, the health questions are different. So this is the way it is in most states, but not all states, okay? So in order to qualify for a traditional Medicare supplement plan from a traditional Medicare supplement company, there's usually a one-page list of questions, and they must say no to all of them. If they say yes to even one thing, don't even send the app in, it won't get accepted. In fact, it'll tell you that right on the directions, right? So they have to say no to everything. With United Healthcare, the number of questions they ask is much less, okay? Within the last 2 years, did a medical professional provide treatment or advice with your kidneys? Within the last 2 years, did a medical professional tell you that you may need one of the following? And there's the list right there in front of you joint replacement, whatever. Then, within the last 90 days, were you hospitalized as an inpatient? Are you currently in a nursing home? And has a medical professional told you they have end-stage renal disease? So basically, if they can say, no, I haven't been in the hospital in the last 90 days, no, I don't have upcoming surgeries planned, and no, I don't have end-stage renal disease, they can get a plan. And I've put people who, I can say, for example, have leukemia onto United Healthcare plan. Why? They don't ask about it. Now, the other thing that's different about United Healthcare is that where all other companies, almost all, so I know Cigna has a little different, but where almost all other companies have one rate class, United Healthcare has more than one rate class. Now, you can see, answer these health questions, determine your rate only if your acceptance is not guaranteed. So then you have to ask all these other questions in the last 2 years. And of course, at the bottom it says if you answered yes to any question, your rate will be the level 2 rate. So there's level 1 rates and there's level 2 rates. So some people, if they're willing to pay more, but they have a health condition, they can still get it. So one of the reasons you need this plan and one of the benefits is, number one, it's the easy underwriting. Right? If somebody has a lot of challenging health situations, they're not in their open enrollment or guaranteed issue situation, you need to consider United Healthcare. It also does not ask for prescriptions. With a lot of the other carriers, they have what's called a declinable drug list. And if they take any medication on there, they're not going to qualify. For this, there's no list of knockout drugs. All right. And they offer more plans. Now, one thing I have to tell you, when I showed you that chart with plan A, B, C, D, and all the ones that are on there, every company who is going to play in the Medicare supplement sandbox, everyone who's going to offer them, has to offer plan A. That's the rule. But they don't have to offer all of the plans. So you're going to find that there's a lot of companies out there that are going to offer plans A, maybe C, F, G, and N. That's all they're going to offer. I mean, they can offer as many or as little as they want. United Healthcare, pretty much in most states, offers all of them. So that's another benefit. The other important thing to note is this. In a lot of states, and now if you live in South Carolina, consider yourself very lucky. Your insurance commissioner has written a rule that if you write somebody a Medicare supplement plan, in all circumstances, you have to be paid full commission. But for many of the rest of us, like I'm in Tennessee, if I write somebody who is a guaranteed issue situation, then there's either no commission or a $25 service fee. Now, please remember, don't get open enrollment and guaranteed issue mixed up. Open enrollment is when you're brand new to Medicare. You're brand new to Part B. Maybe it's when you turn 65 and your A and B are together. Maybe it's when you turn 67 and are coming off of company insurance. But that's when you're first getting Part B. And that's when you have an open enrollment period. That means open enrollment means you can get any plan you want, no health questions, and full commission. Then there's a second category called guaranteed issue. Guaranteed issue is a different situation. Let's suppose that I have a Medicare Advantage plan and I live in Illinois and I'm going to move to Florida. Well, I can't keep that Medicare Advantage plan, but maybe I want to buy a Medicare supplement. So moving from an area and losing your Medicare Advantage plan does give you a guaranteed issue situation for a Medicare supplement. So in that case, it's guaranteed issue, no health questions, and for most states, no commission. But one of the benefits of United Healthcare is they pay at least 50% of the commission on all guaranteed issue business. So that's another benefit to having this company. Of course, there's also some drawbacks to it. All right. You must get, this is interesting, in all years prior to now, if you wanted to sell the Medicare supplement, there was a specific Medicare supplement certification test that you had to take. It was very similar to the Medicare Advantage tests and the prescription drug tests that you have to take to sell those. This year, United Healthcare changed it. They reduced the number of tests that you have to take. In fact, they took away the Medicare supplement test. They combined that information into the Medicare Advantage one. So no longer can somebody just go, well, all I want to sell is Medicare supplements with United Healthcare. I'll take that one test and be done. Nope. You got to take the Medicare Advantage test now in order to sell the Medicare supplement. So they require certification in order to sell the Med Sup. Another thing that's different is that with most Medicare supplement plans, you can enroll somebody up to 6 months before they turn 65. And you might be going, how does that work? They don't even have their Medicare card yet. Yep, that's right. For most carriers, what they're going to do is they're either going to ask you to put the Social Security number in to the Medicare number, or they'll ask you to put 0000000 where the Medicare number is. So let's suppose that I want to sign up for a Medicare supplement plan 5 months before I turn 65. Haven't even applied for my Part B, don't have my Part B, no problem for most carriers. You can still go out and do that. But with United Healthcare, they don't allow that. They treat their Medicare supplement plan very similarly to a Medicare Advantage plan. Certifications are required. You can't enroll somebody more than 3 months in. You can't door knock to sell the Med Sup, right? Now, other companies don't have a prohibition against that. So if you're working with another insurance company and you want to go knock on a door, then what happens is, fine, no problem. But you can't do that and represent United Healthcare. The other unique thing about United Healthcare is they have what's called their rates are based upon two things: a disappearing discount and claims. Now, if you sign up for a Medicare supplement with United Healthcare, say at age 65, you get what's known as a 30% early enrollment discount. And every year for the next 10 years, you lose 3% discount. Now, what they don't tell you is that they also do rate increases based on claims. Their national average rate increase, which they promote in their flyers, is 2.6%. So what you have to do is you have to add that 2.6% on top of that 3%. Now that's the national average for United Healthcare. That does not correlate to every plan in every state. So you just have to know that there's a double whammy for rate increase. They also pay a flat fee instead of a percentage commission based on premium. So where most other companies are going to pay you a percentage of whatever the client's paying, United Healthcare does not do that. It is one fee, whether the client pays $150 a month or $350 a month for their Med Sup. The other thing that some clients don't like is that they have to be a member of AARP in order to get the Med Sup. But they don't have to renew their AARP membership to keep the Med Sup. So, now there's a lot of questions from agents regarding what is happening to Plan F. So let's talk about that quickly. January 1st, 2020, anyone newly eligible for Medicare on or after this date will be unable to get Plan C or F, right? The government has decided that they do not want to offer any Medicare supplement plans in the future that don't have at least some sort of a cost share or deductible that people must pay before the insurance kicks in. So basically what they're saying, Plan F is too good. So they're going to take it away for newly eligible Medicare beneficiaries. If somebody already has Plan F, they can keep it. So if you get Plan F right now, you can go to the doctor every single day if you want to, and you're not going to have any cost. The government thinks that Medicare benefits are being overutilized, so what they're doing is they're taking it away for the newly eligible. And people are concerned that premiums are going to go up. Well, guess what? I hope when you sell a Medicare supplement to your client, you say, I have one thing that I can promise you. This is a standard line in my presentation. One thing I will promise you, and I promise you this: your premiums will go up. There's just no way around it. It's health insurance, right? So what you need to know right now is when someone turns 65, they can choose any Medicare supplement plan they want from any company they want with no health questions. So if I'm super sick and I'm turning 65, you know which plan I'm going to go with? Oh, that's an easy question. Plan F, right? That's going to cover everything. All the sick people gravitate to that plan. So after January 1st of 2020, that will not be the case. People new to Medicare will not be able to get Plan F. All right, they're going to be able to get Plan G instead, or any of the other ones. So only healthy people already eligible for Medicare can get Plan F. So that means companies are still offering Plan F. You can call any of the Medicare supplement companies you want to, ask them, will they still be offering Plan F after January 1? And their answer will be yes. I haven't run into one yet that has told me no. So with more than 60 million people on Medicare, it's not likely the rates are going to go through the roof because only healthy people will be able to join going forward. Now, any one company can have huge rate increases. That's got a lot to do with that particular company. But that's not stopping me from putting people on Plan F. And if someone has Plan F, you know what I tell them? I tell them to keep it. All right? Even though they could save a little bit of money each month by switching to a Plan G, most people would not be happy when the Part B deductible, which is low now, ends up being over $1,000 in the future. Now, I know it might be offending some of you agents who are big Plan G proponents, and guess what? Come January 1, that's what I'm going to be selling too. So there's nothing wrong with Plan G. But here's my philosophy on this. No one wants to have to spend $1,000 out of their own pocket before their insurance premiums kick in. So think about it. You got a female, 65 years old, and she's on Plan F, which is $116 a month, and she'd get Plan G for $87. So she's got a $28 a month. You're like, hey, that's pretty substantial. Well, then you have to factor in the Part B deductible. So take 185 divided by 12, and you've got 1541 that you know that they're going to go to the doctor at least once and meet that deductible. So the savings, monthly savings, is only $13.20 in this particular example. So I believe that difference in premium now is worth protecting them in the future from the Part B deductible going up. And I think we have a precedence for that. Not too many years ago, the average deductible for health insurance was $500 a year. That was the average. Now it is $5,000 a year. So I know what the ACA plans did to the Medicare Trust Fund, and I'm concerned about the Medicare Trust Fund, and I do anticipate that in the future, these Part B deductibles are going to go up, and that could happen to Medicare too. So put your clients in the best plan now to make sure they are protected in the future. So that is the end of day one. Do we have any questions, Corey? If you have questions on anything that I've talked about, you can type them in. I see some people are raising their hand, but not quite sure what to do with that one. Corey will get you.
All right, so one question. Does the penalty for not having coverage apply if they were not 65 yet? So someone that was on COBRA until they turned 65.
All penalties for Part B and D begin starting at 65. So that is a good question. If I was on Social Security disability and I had the Part A and Part B before I turned 65, and I just decided that I didn't want company coverage for my spouse, I didn't want Medicare, I didn't want to get a drug plan. I mean, that would be foolish, but that could be the case. And then I turned 65. There's going to be no penalty. It all begins at 65.
When is Plan G available for guarantee issue?
So right now, if I told you that example, somebody's in Illinois, they leave and they move to Florida today, and they want to get a guaranteed issue plan. They cannot get Plan G as a guaranteed issue plan. But starting January 1, Plan G is going to have all the same benefits and rights is Plan F. So Plan G will be available for guarantee issue for those unique circumstances starting in January.
How do you respond to people wanting carriers with better financials or more reputable name for Medicare supplements?
Oh, that's a great question. So I almost always sell the off-brand Medicare supplement plans. And so I'm selling companies that most people have never heard of before. The key to doing that is to set it up correctly. So when I tell them the price, and I say, every Medicare supplement plan is going to be the same, the price for you is $117.29. And the company that this is with is, I'll just say S.USA. And I bet you've never heard of them. And they go, no, I've never heard of them before. I go, that's good. And here's the reason why. Number one, they're not on the 5 o'clock news, because they've done anything illegal. And number two, they haven't taken all of their profits and sunk them into advertising. Remember, every Plan F from every company must have exactly the same benefits. The only thing that's different is the prices. So if somebody's spending millions of dollars on advertising on TV, who do you think is paying for that? That'd be right. That'd be you. Now, if you want Humana or, put in the name of the company, United Healthcare, whatever, I'm certainly happy to help you with that. Here's what the premium would be, but you're going to have the exact same benefits. These companies have chosen that instead of putting their money into advertising, they work through a network of agents like me, pass the savings on to you. And most of my clients tell me they like to save money. And they go, yeah, me too. So it is very, very low percentage where someone goes, yeah, but I still think I want the name brand. I had one this year, and I know I had one last year, but that's about it. If I make the recommendation that they should go with this company, they almost always are going to go with this, especially after I've done a Medicare review with them. We're going to talk to you tomorrow about how to do a Medicare review. That builds amazing confidence from your clients into you, and they will go with your recommendations.
Are med subs available everywhere?
Medicare supplements are available everywhere. Now remember, Medicare supplements are details, premiums, which plans a company is going to offer, are going to be based upon somebody's zip code. And unlike a Medicare Advantage plan that if you move, you've got to get a different one, with Medicare supplements, think of it like a life insurance plan. If I bought a life insurance plan in Wisconsin, which I have done when I used to live there, I moved to Tennessee, nothing changes. The premiums don't change. My benefits don't change. Okay? Some Medicare supplement companies will want to adjust your premiums if they found out you've moved, but your Medicare supplement policy is portable.
We got a couple more minutes.
Okay.
Just read the question 1 second.
Sure. I'll take a drink of water.
Are we going to do a comparison between MAs and med subs throughout the week?
Yes, we're going to talk about the difference between Medicare Advantage and Medicare Supplement, and we're going to go through some case studies so that when you sit down with a client and you've done your Medicare review, and if you can explain Medicare Advantage or Medicare Supplement, and they look at you and say, hey, which one do you think I ought to go with? We're going to give you some training on how to make a proper recommendation.
Okay, and repeat the answer to when Plan G is available for guaranteed issue.
January 1. Plan G will be available for guarantee issue January 1.
Okay. Someone asked us to complete the following. Medicare supplement plans in the future that don't have at least some sort of
cost share or deductible.
Company information available in Spanish.
By carrier. Most carriers will offer you Spanish materials if you ask for it. All Medicare Advantage companies will. They have to. Most Medicare supplements will as well.
Yeah, we see our batteries dying. Thank you. So we see that ticking up there. So, all right. So, thanks, Don, for that. If you have any other questions, we'll go ahead and answer those privately. The workbook is going to be emailed to you in the morning. So if you didn't receive it,
send me an email or send us an email at support@medicareuniversitylive.com. We use the email that you signed up for or registered for to send that email. So if you didn't get it, shoot us an email, support@medicareuniversitylive.com, and we'll make sure you get the workbook. Also, these are being recorded, so you will get a recorded version that you can watch online. It'll be available for 2 weeks following the end of the session. So it will be available for a limited time, but there will be a recorded version. So tomorrow we'll be back at 2 p.m. Central. So if you have any questions, that email address is a good email to reach out to. We'll see you tomorrow. Thanks, everybody.